Hi, everyone. I'm Raghav, and I'm building OMI, a workforce multiplier for healthcare. What if one call could save a life? Whilst practicing as a physician, I cared for a patient whose heart was failing. It took 3 months of intensive treatment before they could be discharged home, only to return to hospital 1 month later with the same issue. It wasn't a failure of their treatment plan, but rather they didn't have enough clinical oversight when they were at home. One call to check in could have made all the difference. 1 in 3 people in the US suffer from a chronic condition and could face similarly challenging journeys, and that's because chronic disease care is incredibly complex, requiring frequent appointments, medication management, and symptom reviews, and every patient follow-up matters. 1.4 million clinical calls are made each day, and $23 billion is spent on this problem, and that's because clinical calls are really hard to do. They're time-consuming, and they require trained nurses to conduct them. In fact, nurses are at the center of this care delivery. Skyrocketing demand from patients means that millions more calls are needed each day. But crippling nursing workforce shortages means that health systems simply can't cope. Solving this problem demands deep clinical expertise and vertical workflow integration, not just another AI receptionist. Robert is a full-stack developer and has conducted frontier machine learning research in nanophotonics and neurosurgery at Stanford during his PhD. I'm a physician with background in internal and emergency medicine and Stanford MBA, and have conducted AI projects with the Stanford Institute for Human-Centered AI. We met on campus through our shared interests as Knight Hennessy scholars, and we're solving this problem by building OMI, a seamless workflow to multiply the healthcare workforce. Our control panel makes it easy for nurses to always remain in charge, while our clinical intelligence scales the number of patients they can see through parallel calls. And it's intuitive for patients. All they need is a phone number to access AI-powered healthcare. The result is that we multiply the workforce output by 5x or more through our parallel calls. And here's how it works. Nurses send a list of patients who need to be contacted to the OMI dashboard, and then we do the rest of the heavy lifting, navigating the EHR, calling patients in parallel, and automating the documentation. But behind the scenes, it's a lot more complex. Our RAG is purpose-built for navigating the complexities of EHR and providing crucial clinical context for conversations. Our clinical supervision model provides automated safety escalation. And our clinical LLMs are fine-tuned on gold standard conversations to provide the best possible experience. Together, this means that our dashboard massively scales the number of patients each nurse can care for on a given shift. And we charge 1/5 of the cost it takes to serve patients today. The market opportunity for outbound clinical calls is huge. It's approaching $5 billion. But when we add in inbound calls, it doubles to almost 10, and it's growing incredibly fast as care is increasingly shifted to the home instead of the clinic. Generating evidence is the key to driving adoption in hospitals, and that's why we're starting by conducting clinical studies at top institutions before expanding to private clinics, hospitals, and other use cases. And we've gained significant traction in just 4 months. We're on track to conduct a frontier clinical study at Stanford very soon, and are in final stage conversations with 3 other clinics. We are the end-to-end clinical solution scaling work done by healthcare professionals. We don't replace nurses, we empower them, and we deliver ROI to clinics by increasing their direct work output. Our vision is to leverage AI to keep the humanity in care delivery. We envision a future where nurses have more time to spend with patients who need them the most. We're OMI, and we're here to reimagine the future of healthcare together. Thank you.